Our office provides a full scope of periodontal treatment, from traditional treatment to the LANAP protocol. Although much of the time we are recommending the LANAP protocol, I think it is important to be able to discuss and provide a full scope of periodontal treatment. Many patients with gum disease choose to do little or nothing about it, and they will end up typically experiencing tooth loss and then some type of denture replacement for that treatment choice. The traditional treatment choice would be to start with what we call initial therapy. Initial therapy is most of the time some type of deep cleaning procedure, which in the business we call scaling and root planing, oftentimes in combination with some type of occlusal treatment, and then oral hygiene instruction with a follow-up, typically 6 weeks to 3 months following the initial treatment. At that time, if surgery is indicated, then we begin to discuss surgery. So with the traditional treatment, much of the time we're doing some type of surgical intervention. That would involve making a flap and then again cleaning the teeth. Depending on what the patient's needs are at that point, we can either adjust the bone, that would be traditional osseous surgery, or we can do some type of guided tissue regeneration, which is the placement of materials, be it bone or a membrane, into an area to try and regrow the bone that's been lost. At that point we would go ahead and suture, oftentimes place a periodontal dressing, and the patient would then heal. Healing times, at least from a discomfort perspective, is usually 7 to 10 days. And depending on which procedure is done, usually the follow-up is done 3 months to a year following. As far as laser treatment goes, there is no initial therapy. The initial therapy, if you will, is done at the time of the laser treatment. So it's a much quicker procedure, if you will, for the patient, in that the number of visits is far less, oftentimes as much as a third less.